Hello, welcome, and thank you for attending the Colorado Dental Board Stakeholder Meeting via webinar today. The date is Friday, November 1st, 2024, and it is 1:03 p.m. Before we get started, we'd like to introduce the staff members from the Division of Professions and Occupations who are present. My name is Nate Brown, and I'm a regulatory analyst with the division. Also attending are Yukon Morford, Program Director, and Marie Rascon, Regulatory Coordinator. The division has transitioned to a platform that is 100% virtual, and we appreciate your flexibility. DORA makes decisions every day that may affect your life and your business, so your input is vital in the rulemaking process. Throughout this process, our goal is to create regulations that clarify and explain legislation, ensure minimum competency to enter and continue practice, and provide only what is absolutely necessary for consumer protection without creating unnecessary barriers to the marketplace. Your input will be part of the information that goes to the board as it considers adopting revisions to the rules. More specifically, today we will receive feedback on proposed changes to Rule 1.6, licensure of dentists, dental therapists, and dental hygienists. The purpose is to further define licensure regarding CODA and the portability. Rule 1.10, minimum standards for qualifications, training, and education for unlicensed personnel exposing patients to ionizing radiation. The purpose is to request the dental board recognition of RDA-AMT and DAR-AMT certification examinations to qualify dental assistants to perform radiography. And Rule 1.14, anesthesia, the purpose of which is to revise the rule regarding multiple issues. As you may have heard, this meeting is being recorded and will be posted on the board's website by the close of business on Monday. As the stakeholder meeting is held solely via webinar, please raise your hand by using the hand icon in the Zoom app. If you would like to speak, and we will unmute your line so you will be heard by everyone, or you can type your comment in the question section and we will read it aloud. Before we start taking comments, I want to ask that anyone providing comments, please state your name and the name of the organization that you represent, if any. Feel free to provide either general comments on the rules or specific comments on the proposed language. Please limit your comments to no more than 3 minutes. There will be a timer on screen so you can keep track of that on your end, and try not to repeat something that was already said. Stating you're in full agreement with someone else works just fine, and we will note it as such. Some final housekeeping matters before we start taking testimony here. If you are using audio through your computer, please remember to put any phones on vibrate or turn them off. Whether you are using computer or phone audio, try to keep background noises to a minimum when speaking. And with that, we'll open it up for any questions and comments. Again, please, you can raise your hand or type your question into the Q&A. Either works equally fine. And we can get going here, but I do not see any hands raised at the moment. Here we go. Thomas Harris. You should be able to unmute on your end. Please go ahead when you're ready. You'll have 3 minutes.
Okay, sounds good. Yeah, I just wanted to clarify, are you going to start at the top and kind of move down through the rules that are listed, or would you want me to comment on Rule 1.14 now?
This is really your meeting as the public, so feel free to direct us wherever your comment is appropriate.
Okay, sounds great. So I did submit some comments that were posted. I think I submitted them about an hour ago, so those should be up there. If you want to take a look down at L.4 and under Rule 1.14, that's where I will direct my comments mostly. So the suggestion that we're making, this is based on experience. I'm a physician anesthesiologist and practicing in Colorado. And for the last few years, we actually sent a letter about this rule back in 2022. And so what we've run into is a really kind of a major issue related to, anti-competitive nature of the rule when it refers to physician anesthesiologists and dental anesthesiologists. where the dental anesthesiologists need to only receive one inspection to go into multiple offices and travel, physician anesthesiologists are required essentially to have a separate inspection in each office they go into. And so in my comments, I suggested that in section L.4, that the first section be completely removed to remedy those issues. And then we suggest replacing the language with what has been put forth in the kind of draft notes. Essentially, for physician anesthesiologists, that there be no requirement for the dental office to require an inspection when they contract with a non-dentist anesthesia provider. And then, but that the dentists still need to be aware of the rules is important, but that they don't actually need to receive an inspection. This would really kind of put the onus back on the correct boards to regulate the specific entities. So the medical board in my case, the nursing board in the case of CRNAs, whereas we're already regulated by that board, and we should be able to practice in offices without a dentist having to do a separate inspection. So this would really kind of relieve some of the pressure on that situation, reduce the red tape. It also open up, a lot better access to care. We've got offices that are in remote areas around the state with a lot of pediatrics and other special needs patients that are in need of care, and we're running into the issue over and over again where there's just not a way to get an inspection done. It takes a long time, et cetera. So anyway, that's my time is up. But if you look at my comments there, hopefully we can springboard off of that.
Excellent. Thank you so much. I appreciate your comments. And if you wouldn't mind lowering your hand when you're done, just so I make sure you're not waiting to get, thank you. Appreciate that. The next person with their hand raised, and I will apologize for anybody's name that I butcher, but Rebecca Steinbach. You should be able to unmute on your end. Please go ahead when you're ready. You'll have 3 minutes.
Can you hear me?
Loud and clear.
Excellent. So I am following up with Dr. Harris's commentary. I'm actually a general dentist up in a rural area of Colorado, in the mountains of Colorado. And so I am just kind of providing testimonies just to modify these requirements, just because with these requirements of the anesthesiologists and inspections happening in the office, it's really limiting our access to care. We have several special needs patients that require sedation. We have a very, very difficult time finding dental anesthesiologists willing to make the trip due to distance. So we're limited in the people who will come up to our area. And we're finding extreme difficulty finding inspectors to travel to our office and who actually understand the current requirements for our physician anesthesiologists to care for our patients. And really the current requirements in the Act just represent an undue regulatory burden for our, which is impairing access to care for our patients. So we are really looking forward to a change in these regulations so that we can continue to improve the quality and care for our patients across the board. So thank you for your consideration.
Thank you so much. I really appreciate your comments and taking the time to come out to us today.
Absolutely.
And I did also just want to issue a blanket apology if I don't refer to you as by your honorific. If I realize most of you are probably doctors, but it's just your first name on the first and last name on the list I have here. So I apologize for not using that title that you've earned. But up next we have Kevin Patterson. You should be able to unmute.
Yep, I did.
You'll have 3 minutes.
All right, thank you. I'm an oral maxillofacial surgeon in Denver, and I'm actually the current president for Colorado Dental Association. And I just want to agree with two things with Dr. Harris and Dr. Steinbach as far as the disparity between the dental anesthesiologist and the medical anesthesiologists and CRNAs, as far as the need for office inspections. So I agree with the way they're trying to change the language in there. I would like to see something put in that if these dental providers are going to be contracting with anesthesia providers to come into their office, that they have their minimum, life support certifications that are going to be required. And I'd like to see that spelled out, in this process, under the non-anesthesiologist dental provider, so for the person providing the dental treatment, not the anesthesia, because most of the anesthesia providers, and we do occasionally have CRNAs or medical anesthesiologists come in when we're not doing sedations ourselves. And most times they come by themselves, and they're requiring then, assistance by the doctor and by the staff as far as, secondary support systems if something happens during the anesthesia. So I think if we go this route, and I'm 100% in favor of it, that there needs to be stipulation either in rules or under the Practice Act, which we're in the process of updating, that state the requirements required by these individuals if they're going to have anesthesia services provided in their office without an inspection. Thank you.
Thank you so much, Doctor. Appreciate your time and consideration of these issues. Okay. Let's see. I think I may have just accidentally put someone's hand down. So if I did that, please put it back up. But at the moment, I see Karen Foster. You should be able to unmute on your end. Please go ahead when you're ready. You'll have 3 minutes.
Hello, thank you. I wanted to speak to section 5 that's right below there about the operating room setting. Oh, no, you were good.
Oh, go back up, Maria.
Yeah.
There it is. Yeah.
I practice at Denver Health as a pediatric dentist, and we do moderate sedation outside of the operating room. There's lots of settings in a hospital where procedural sedation is done by dental providers outside of the operating room. And given the requirements that we satisfy with the Joint Commission and safety protocols within our hospital, a site inspection is kind of redundant and an unnecessary burden to getting permits for moderate sedation. So I would recommend not making that change. Thank you for your time.
Thank you so much. Really appreciate your comments. Okay. And like I said, I think I saw someone's hand go up, and I may have taken it down by mistake. So please put your hand back up if you were waiting to speak. I haven't seen any written questions come in yet. We have a hand from Jeff Call. You should be able to unmute on your end. Please go ahead when you're ready. You'll have 3 minutes.
Oh, hi. I actually took my hand down. I was going to make the same comment that Dr. Foster made. So I'm Jeff Call. I'm a pediatric dentist. I'm here today on behalf of the Colorado Academy of Pediatric Dentistry. And again, in hospital settings where pediatric dentists are on staff and performing moderate sedation, that procedure is done most often outside of the operating room setting. And again, I think the JACO and hospital inspection requirements actually exceed those that are currently required by the inspectors who come on behalf of the board. So I would also oppose the addition of operating room. I think leaving it at hospital setting probably is adequate.
Okay, thank you so much. Appreciate your comments. Let's see. Next up, I see Dr. Patterson, I believe. Please go ahead again on your end. You should be able to unmute. You'll have another 3 minutes.
Great, thanks. I guess just another area in this 1.14. So if you can go to R, item 4, the letter R, item 4, about the anesthesia application reinstatement. So in this section, it's previously been stated that if you have an inactive permit for anesthesia, as long as it's within 2 years, you can reapply with just stating the CE you've taken and the experience you've had before. But I'm seeing in this document now that that's being changed to 5 years. 5 years of someone not having a permit, not providing anesthesia is a lifetime in the anesthesia world for both providers and then also for their team. Teams need to see things happen all the time because most times bad things don't happen, but they need to be continually exposed to the anesthesia procedures and the protocols with providing anesthesia, as well as any potential complications that arise from doing that. And I think going from 2 years to a 5-year period where you can reinstate your license with just minimal documentation of why you're doing this again, I think at 5 years, it should be an entire re-permitting and office anesthesia site inspection process. Again, because of the length of time and the safety, of patients that are going to be compromised by a decision like this. Thank you.
Thank you so much. Okay. And Dr. Call, I do see your hand is still raised. I'm going to lower it, but if you do want to keep have further comments, please just put that back up, and we'll call on you again. But I don't see any additional hands raised at this point. Let me check the Q&A. I haven't received any written comments yet. But we do have almost an hour left of our scheduled time today, so certainly don't want to rush anybody through this process. I see a hand raised from Mercedes Aponte. You should be able to unmute on your end. Please go ahead when you're ready. You'll have 3 minutes.
Okay. Actually, I'm a dental hygienist, and I wanted to know if this, I guess I'm looking at the earlier part of the sections that are highlighted in red. Does this have anything to do with dental therapists, or are we looking at some of the requirements from CODA for dental hygiene, dental therapy?
I not really myself in a position to answer that sort of substantive question. We do have the program director on UConn. I don't know if you'd like to chime in on that.
Yeah, I don't think any of these changes had to do with dental therapists. I can't remember, but I don't think any of them did. Yeah.
Perfect.
Okay.
Thank you so much.
All right. Yeah, I was looking through and wasn't sure that I saw anything. It had something to do with hygienists and the occupational credibility portability, the credential portability program. So in other words, on page 11, section G, does anybody know what the purpose of that one is? Like, is there a purpose for removing section 2 under F1? Are we removing board approval or graduated from dental hygiene school on that page 11, section G2 that's been highlighted? Is that the proposal?
Again, I'm not exactly sure why the board has proposed that particular change, but I'll open it up for UConn.
I think somewhere somebody wanted to strike that, so that's what we were going to do. I mean, these are just proposed changes, so if you disagree with it or you agree with it, you're welcome to add comments. But this isn't finished. It's not. This isn't what's going to happen. It's just a proposed change. So if you agree with it, you can. If you don't, you can add comments.
Well, I at this point I'm not sure because it's just F1. Is it that whole section? It says, section F1. That's got 3 parts to it, which includes licensure and CODA certified, education, so to speak. So I don't agree with that if that's what we're taking out, I guess.
Yeah,
Yeah.
I don't think we're taking out F1. I think we're just taking out this sentence in G2. Did that answer your question?
Yeah, okay. If it's just yeah, well, I just wonder what the rationale is. Is it just superfluous or redundant, or is there some sort of issue with or is there some sort of effect on licensure and portability of licenses? So I guess that's what I have as a comment. A little vague.
No, that's we really appreciate you raising those kinds of questions. Certainly, and that kind of ambiguity or confusion is certainly something that the board will take into consideration as we move forward with this rulemaking process. And again, because there's a board in particular involved with this program, can't really speak for why they might be looking at that particular change here in this forum, but we can certainly take those concerns and that confusion and present that to the board, as well as with every other comment as well. We have a hand up from Alyssa Eberl. I really apologize for messing up anybody's name, but you should be able to unmute on your end. You'll have 3 minutes. Please go ahead.
Thank you. My comment actually, I think, ties into Mercedes' comment as well. So I'm representing the Colorado Dental Hygienists Association, and I'm also a practicing dental hygienist. And on page 6, under C3 is, I think, where this striking originates. And there was a comment that says that we are requiring certain things for license applications by endorsement that we also require for license applications by examination. And the question, I think, was, do we need to ask for these things if they're applying by endorsement, or is that just assumed if they have a license in another state? And so then I think subsequently it was being removed from that section on page 11. And we would speak against removing this specification and rules here. And yes, we're asking for the same things under endorsement as we are under examination. So they're essentially very similar applications, but there are states that allow dental hygienists to get licensed. And I think it probably only applies to dental hygienists, maybe dental therapists as well. But there are states that don't require CODA accredited education. And there are states that don't require the board examinations. And there are states that allow foreign trained dentists to be licensed as hygienists. So just by looking at the fact that they have a license in another state doesn't necessarily indicate that they meet Colorado's requirements for licensure. And so I think it's important that we continue to ask for that documentation to ensure that those individuals do still meet Colorado's requirements for licensure. And I think that was the point that the previous commenter was making, was we don't want to diminish the requirements that currently exist in statute.
Excellent. Thank you so much for your comments. Okay. I have a couple of hands raised from folks who've already spoken, so I will move down the list just a little bit and go call on Molly Pereira. Again, apologize if I've messed up your name, but you should be able to unmute on your end. Go ahead when you're ready. You'll have 3 minutes.
Thank you. My name is Molly Pereira. I'm the executive director of the Colorado Dental Association. And I was wondering if we could back up for just a minute, and perhaps UConn knows the answer to this. But, when we got this notice for the meeting today, I was really hoping that maybe we could start with just a little bit of who's submitting these changes and a justification for a change now, especially with the sunset review of the Dental Practice Act coming up in January legislatively. just I'm curious on the urgency behind these changes. Where are they coming from? And it is just kind of caught us off guard. So I was looking for a little more information on the background.
Yeah, so I mean, all these changes have been kind of been swirling around in the past, like, I don't know, since I've been program director, so probably the past 4 years. And so we were just finally able to get everything together and get them into one rulemaking. I don't think there's an urgency for any of this if you think some of it's going to be covered in sunset. But yeah, these are just all changes that have been just kind of swirling around for the past 4 years. So, and we kind of started this process before we even got the sunset report back, before we even kind of really got into sunset. So all of these changes none of it's coming from the sunset at all. So hopefully that answered your question, Molly.
That does help. I was just wondering if, I guess when I came to this meeting, I was hoping that maybe we would just be going in order by pages, and then there would be a little bit of justification for why each proposed change, because I think that most of what I'm hearing so far is some of it anyway, is just confusion as to why. And after going through, the sunset process with DORA regulators, I know that the why and patient safety is the first thing we always have to answer. So I was just wondering if there was any more information specific to each change.
Yeah, and honestly, these are just notes that we've taken throughout the years, like I was saying. So it's going to be hard to say who it came from. Like I said, it's been 4 years. I can't even remember, when the last time you guys did a real in-depth, or when a real in-depth rulemaking was done, especially regarding the anesthesia rule. I think that's been on the back burner for a long time. So it's hard for me to say where some of these comments came from in the history, but I mean, you're welcome to go through these comments and say, you don't agree with these items. If you don't agree with the changes right now. I mean, I think right now it's mainly just getting everybody's comments. It's really not about, answering questions and providing feedback. This is more about, these are the changes that have been proposed, and you guys are welcome to comment and disagree or agree with them.
Absolutely. And, we have a number of dentists on this call too, each with expertise in different areas. So we are prepared to go through. I was just wondering if there was anything we needed to know before we continue. Thank you.
Thank you so much. All right. I will, if you wouldn't mind lowering your hand, just so I know you're not waiting to speak again. That would be great. But right now, Dr. Patterson, you should be able to unmute on your end. Please go ahead. You'll have another 3 minutes.
Thanks. I wanted to reiterate what Molly just stated. Can we go to the very beginning of this document and start with the first, so 16A10 on page 3 and 4? Because I agree a lot with what Alyssa Everly stated also, because there's changes that are being made to education requirements for licensing of 3 groups, basically, what a lot of these changes are: foreign trained dentists, dental therapists and dental hygienists, and dentists. And it's all centered around this endorsement through the Occupational Credential Portability Program. And to what Alyssa made a point to, there are hygiene programs, there are dental therapy programs, there are dental programs where individuals have gotten licenses in other states that are going to, without completing a CODA accredited education, and are going to be able to get a license in Colorado through this rule. And in my mind, that seriously puts a lot of pressure on the dental community. It puts a lot of pressure on the board to have to evaluate each individual's training, because they don't know anything about the program where these individuals came from. So in all, and I can read a whole, it's all of it. I can read a list of the statutes where you're changing it, but at the end, I'll also submit some written comments that you can have too. But essentially you're potentially letting people in that do not meet the same educational requirements that are being made for Colorado healthcare providers to work in Colorado. And you're significantly at risk for opening the door for individuals that do not have proper verified training. So it's in section 1A, it's 16A10, 16B, 16C, 16F, 16G. All of these standards are being changed to eliminate qualification requirements under the Portability Act. And I think that is a potentially big mistake. And if I was on the board at this point in time, I would not be the one that would have to take each individual's license and say, is this equal to the educational standards of somebody that's practicing in Colorado? Because that's essentially what you're saying in this document. Thank you.
Yeah,
Thank you so much.
hey, I wanted to jump in real quick too, going
Please.
to what Dr. Patterson said, and also what I believe Molly was talking about. We don't have to go through every section here if you guys don't want to. You guys like you guys talked about, you guys are more than welcome to submit comments, and that might be easier than going section by section. I mean, if you submit them to the email box or to Nate, might be a little bit easier if you guys submit it in written form than going over it here vocally. I was just giving that option to everybody. I'm sure everybody knows that though, but
Yeah, absolutely. Thank you, Yukon. Certainly we'll provide the contact information that you can submit any written comments after this up until the eventual hearing on these rules. And certainly those are considered on equal footing with any comments we receive in this setting as well. Let's see, Dr. Call, you should be able to unmute on your end. Please go ahead. You'll have another 3 minutes.
Again, this is going to be redundant from what the last couple speakers said. I think if you scroll through this in order and then allow anybody who has any input to comment on each change, this would be a lot more efficient than jumping all over the place. But I do want to speak to this particular issue. You guys actually outline the reason for this change in the board report for Sunset. Under endorsement, the requirements for for verification of education are removed, I believe, because there's an assumption that the occupational credential portability program will have already vetted these applicants who are licensed and qualify for the OCPP. The Dentist and Dental Hygienist Compact does require CODA accredited education to participate in the OCPP. But at this point, the compact rules have not been really codified. They're just now starting. So I agree with Mercedes, Alyssa, Kevin. I think we're premature in removing that requirement for endorsement. And I would encourage the board to, at a minimum, still verify that the licensee is a graduate of an accredited program.
Great, thank you so much. Appreciate your comment. Okay. I see the hand raised up again. Mercedes Aponte, please go ahead when you're ready. You should be able to unmute. You'll have another 3 minutes.
Yeah, this will be quick, and it sounds like we want to be pretty succinct. But I guess I'll go to the board's report for Sunsets and look that up and look for that rationale, etc. I do appreciate that people are bringing that to the fore. I did also look at dental therapy, and I realized a couple of years ago we passed dental therapy in the legislative process. We passed dental therapists, I guess, codifying that they can come and work here with these qualifications. But there's 3 states in the 3 schools in the nation that only 3 schools that allow or certify dental therapy through CODA. I thought that was a little premature with this discussion. We don't even know. And it seems that it's not quite the same at all the schools. I went and looked them over. Anyway, I guess that's neither here nor there. But so when is the next When is the time to submit discussion or have discussion? When is your next meeting? Thank you.
Thank you so much. Appreciate your comments. So in terms of the process, moving forward, just kind of give you a picture of what that might look like. This is the very beginning of this rulemaking process. So, UConn can speak better to this in terms of the schedule for when the board might hear this. But certainly there's a lot of time in between now and whenever this rule is finally adopted, if at all, per the board's discretion. There are a lot of steps along the way in between now and then. So this certainly is sort of your first bite at the apple, if you will, and you'll have a lot of opportunity to re-engage with this process as these rules move forward. Certainly.
Yeah, and so these would have to be reviewed at full board, and so there's only, let me see, I got the schedule up. The schedule is also posted on the website. So the next full board is January. These were just approved yesterday, I believe. January, May, July, and October are the dates of the full board meetings. So that's when the full board meets. That's when they review rules and all that. So
perfect. Thanks, Yuka. Just based off of suggestions here, Maria, if you wouldn't mind, I'm just starting to kind of scroll down slowly as we work through this document. We can maybe take a pause at each of these suggested changes and see if that raises any additional comments or questions. I think that may have been one we were already discussing there, so we can probably move on from that one. But of course, just let me know if you want to go back and discuss that particular issue that we just went past. And I don't see any hands raised at the moment. Looks like we've gotten, oh, someone said thank you, so I appreciate that. Mercedes Ponte, please go ahead. You'll have another 3 minutes.
Thank you. One more thing. We were talking also, I think this came to us with consideration for radiographic licensure or allowance. Is that in this particular section that was? I don't see that in here. So I don't think that's on the menu today, right?
UConn will, you'd have to speak. I believe there, if I'm not mistaken, there is a section here about something about radiographic certification or something like
Maybe
that.
I'm,
I recall. Yeah.
all right, I'm not very good at this. Okay, thank you. That's really all I have.
All right, thank you.
Thanks.
Oh, my apologies, Ms. Ponte. I saw your hand went back up. So if you have more you'd like to add, please go ahead. Nope, it went back down. Okay, my apologies. I see Dr. Patterson. Please go ahead. You'll have another 3 minutes when you're ready.
Thanks. It's actually on the section you're on right now. That was the last one that I had comment on. There's confusion as far as 16 hours, 17 hours of board approved coursework. For our dental licenses in Colorado, it's 17 hours of anesthesia training required, CE required for maintaining our anesthesia certification permits. So I'm thoroughly confused where I'm seeing 16 in one paragraph, 17 somewhere else. So, I mean, I would recommend just keeping it straight across the board with everything, all the other sections, and having it at 17 hours of CE that are required for during the anesthesia portion of it.
Okay, great. Thank you so much. Appreciate your comment.
And then as far as the radiology section, you know, we saw that is something that's going to be talked about today, but the document that we had no comments or changes made to that section. So we're completely at a loss as far as, you know, what's even being proposed there. Because then if you go to section 110, 1.10, that's radiology, there's no markup. So I guess I don't know what we're talking about there. Thank you.
Thank you so much for your feedback. Yukon, I see you unmuted. Did you want to address that at all?
Yeah, I can look to see why we put that on the stakeholder. But I mean, I think since it's on the agenda, if you guys have any comments, if you guys think anything needs to be changed, I think you guys are welcome to bring up any, you know, any comments that you have on that section. But otherwise, I can look to see what we were planning on there. But otherwise, I think you guys can open it up. I mean, it's on the agenda, so you guys could open it up.
Yeah, that's a good point, Yukon. I certainly, you know, it was noticed. So even though there might not be any proposed changes here, if you all have any comments about that section, how it could be improved or altered in some way, it's more than appropriate here. Next hand up I see is Karen Foster. You should be able to unmute on your end. Please go ahead when you're ready. You'll have 3 minutes.
Thank you. I was going to speak to the section that we were on. It's page 29. I don't know what section it is at this point. I don't have a problem with the 17 hours, and I would just agree with the comment about the vague reference to coursework must contain an appropriate combination of didactic and practical skills training. I know that has been an area of confusion for practitioners, and outlining more specific guidelines and rule would be great. Thank you.
Thank you. Appreciate your comment. Dr. Patterson, looks like your hand is back up. Please go ahead, sir. You'll have another 3 minutes.
Thanks. I feel like this is my meeting today. So, you know, I guess no one's really prepared to talk about 110 section, but, you know, we've heard through rumor mill that there's, you know, potentially some regulation changes coming down the pipe to where requiring certification by dental assistants to be able to provide radiography. So I guess that's why we assumed that this section was in there, just because of what we've recently heard over the last couple of days through the rumor mill, which sometimes is incorrect, but I'm guessing in this point it probably is correct. So I don't know if Yukon has anything to say on that, but or if there's going to be more changes made to that, you know, that would give us time to, you know, appropriately evaluate and come up with comments for that section. Because right now I'm comfortable with the way it reads.
Yeah, I think we can put that in the comment. I think that's fine. Honestly, I didn't put it on. It wasn't put on the agenda for any specific reason from what I remember. And I'm not seeing anything that I have that was supposed to go in the packet regarding it. So I think it's fine to put your comment saying that you think everything's fine with it and there doesn't need to be any changes for now.
Yeah, absolutely. That's perfectly acceptable comment. But Dr. Patterson, I will go ahead and put you back on mute and lower your hand. But of course, feel free to keep putting it back up. We did get a written comment from Alyssa Everell. The stakeholder meeting email said that the changes to Rule 1.110 or 1.10, excuse me, had to do with accepting additional sources of training. But we would like additional information on this before providing input.
Okay, that's fine. I think we can look into it more.
Okay, perfect. Yeah, thanks, Yukon. Looks like a hand may have gone down, so I will call again on Dr. Call. You should be able to unmute on your end. Please go ahead when you're ready. You'll have another 3 minutes.
I was just going to point out in the section that we were just in, the reference to the 2012 ADA guidelines. I think you had already noted that the ADA guidelines for pain control, teaching, and sorry, going too fast here. The American Dental Association guidelines for teaching pain control and sedation to dentists was updated in 2016. So the most current reference would be the 2016 version. There's also a pediatric version of that was updated in 2021. But if you're worried about guidelines being out of date, maybe you can just refer to the American Dental Association guidelines for teaching pain control and sedation for pediatric patients and adults. And then whatever the most current version is would be the appropriate version.
Excellent. Thank you so much for pointing that out.
And then in regard to 110 for ionizing radiation, I don't see any reason why we wouldn't, except qualifications that were beyond what we're currently asking for in Colorado. So, certification by dental assisting boards. But I also believe that the current requirements in Colorado are appropriate.
Perfect. Thank you so much. Appreciate your comment. Okay. I really appreciate the robust discussion this afternoon. Let's see, I don't think we have any other comments that can really read out loud at this point. I don't see any additional hands. But Maria, if you want to keep kind of scrolling through, can hit some of those other potential changes and see if that raises any additional comments. I'll keep a lookout on the Q&A box here. Scroll through, I don't see any hands raised at the moment. Karen Foster, thank you so much for that link to the updated guidelines. It's very helpful. Thank you. Okay. Well, I don't see any additional hands raised. We do have about 40 minutes left in our time together, so I certainly don't want to rush anybody. And I did just see a hand go up. Karen Foster, please go ahead when you're ready. You'll have 3 minutes.
Hello again. It was scroll back down. It was as part of the residency. If I recall, that was a big topic of discussion when the last time the anesthesia rules were opened. And there was concern about being very specific about residencies because we didn't want to disenfranchise any general dentists who have done the correct courses in order to be able to provide sedation outside of a residency. And so I think that wording was selected for educational route. So I think it would be incorrect to list out the residencies. Thank you.
Thank you so much. Appreciate it. Okay. Looks like we got a written comment from Lauren Harvey. Following what Dr. Kevin Patterson asked about radiology and certification for dental assistants yesterday at the dental board meeting, they had agenda item number 5, and it sounded like they wanted to add that for today's rulemaking discussion. That agenda item number 5 was request for dental board recognition of RDA, AMT, and DAR AMT certification examinations to qualify dental assistants to perform radiography. Thank you so much. I appreciate you providing some of that context there. And that's certainly something we will present to the board. Absolutely. Mercedes Aponte, please go ahead. You should be able to unmute on your end. Go ahead. You'll have 3 minutes.
Yeah, thank you. So I guess I assume that they aren't certified or qualified when they go through? Is that if we're requesting it or asking that it be reinstated now, or I always thought EAs and EDAs were certified to do that. I don't know their education, but I assumed that. That's it. Thanks.
Thank you so much. Dr. Call, excuse me. Please go ahead. You have another 3 minutes.
I just wanted to speak to Mercedes' comment, and I think I've said this before. In Colorado, we do not require certification to be a dental student or a dental assistant. And so the route for qualifying for ionizing radiation is what is currently outlined. We do have dental assistants who come to the state of Colorado who have been certified in other states or have completed programs that are much more robust in regard to their radiology education than a lot of the programs in Colorado. So again, I would support allowing their certification to meet the requirement, but would not change the current rule for dental assistants in Colorado.
Excellent. Thank you so much. Appreciate you chiming in on that issue. Okay. We can just at this point keep crawling through, see if get any additional comments. I don't see any new written comments at this point, but we'll certainly keep that open. Again, we have about a half hour left in our time scheduled today, so certainly no rush. But
yeah, and Nate, going back to the radiology thing, we did on yesterday's full board meeting, we did have that item that we had already pre-planned to be part of this, or to be part of the discussion for stakeholder meeting, but I believe that's regarding education requirements regarding radiology. I'm not sure if it has to do with that. Could be the reason why we put it on, and I'm not sure if it was added to what you guys sent out for the stakeholder meeting. It was regarding let me see. Yeah, it was a request for dental board recognition of RDA, AMT, and DARA AMT certification exams. So yeah, I'm just not sure if that's if these are the exact same. That's the reason why we put it on for stakeholder comment or not. So, but that was seen at yesterday's full board meeting. So,
okay, yeah, no, I appreciate that, Yukon. Thanks for that background there, and sounds like certainly some additional discussion for the board.
Yeah, exactly. We can, like I said, we can look into it a little bit more as well.
Excellent. Yeah, for sure. All right. Looks like Maria has parked us on this next group of revisions here, proposed revisions, but I don't see any hands or questions about it. So I think we may have touched on this section earlier. So I think we can maybe keep scrolling. And that looks like we're at the end of what has been proposed for today. So I guess we'll take a pause there and see any last comments here. Looks like we may have gotten got a written comment from Mercedes Aponte. It seems logical to allow trained/certified EDDA, DAs, etc., to practice in Colorado when our requirements aren't that stringent. Appreciate that comment. Thank you so much. We got a hand raised from Molly Pereira. Please go ahead when you're ready. You'll have additional 3 minutes.
Thank you, Nate. So I just had one clarifying question. I know that written comments are welcome following this. can you tell me what type of deadlines we're looking at for those written comments, and then next steps in terms of this rule? This sounds like kind of a preliminary stakeholder meeting, so there would be follow-up meetings coming up, but can you give us a timeline of when those are going to happen?
UConn can probably speak a little bit more to that. It'll be, have to be wrapped up with the board schedule. And, one of the next steps will certainly be taking these comments, having the board review them, look, hear what everybody has been saying. And yeah, certainly other opportunities for, as the board decides to have other stakeholder meetings, certainly opportunity for that as well. But given the as you said, the preliminary nature of these rules here, these revisions here, it will probably be a little while. There's quite a few steps baked into the rulemaking process here, so it will be. I don't think it's been scheduled out in stone by any means. And I say UConn, you unmuted. Please go ahead.
Yeah. So, I mean, I can definitely. I'm going to work with Nate and try to figure out if we can get these ready. I mean, we're a couple months away, so I mean, I think we have plenty of time. But I could. The next full board is January, so I could definitely take these to January if Nate's prepared. I mean, if everything's works out on his end, I could definitely take him to January. We could flesh out some of this a little bit more and kind of narrow down things or narrow down items that you guys are more concerned about and items that you aren't. So I think if you're planning on submitting more comments, I think you have a little while to do it, because I think the quickest I could get it would be January to the next meeting. So
awesome.
Did that kind of answer your question, Molly?
Yes, thank you.
Okay.
Awesome. Thank you so much. And I do see a hand up from Mercedes Ponte. Please go ahead when you're ready. You'll have an additional 3 minutes. Oh.
Thank you. Sorry, I used to work at the Capitol. I kind of am thinking about sunset, and so hopefully, I thank you, UConn, for your effort in getting that by January. The start of legislative session would be great for sunset as well. You'll probably send all this out to everybody for a review, or just are you kind of compiling these to send out? Or do we just go to the website? What would be your best?
Oh, go ahead, UConn.
So I think the next steps would be that we're compiling all you guys' comments right now. We're compiling all that. You guys won't get a copy of it again unless the board says they want another stakeholder meeting. So we're compiling all this right now. The next step would be to send it to the board meeting in January, and then it's up to them what they decide they want to do on whether or not they want more stakeholder meetings, or if they want to proceed with changing rule, or if they don't want to change rule. So I think those are the next steps. You guys won't get another version of this. So submit everything you possibly want to submit right now. It'll go to the January meeting, and then they can decide how they want to proceed from there.
Okay. Okay.
And just as a little bit of a clarification there too, as part of the notices that go out for these kinds of meetings, either stakeholder or the actual rulemaking hearing, we do include a link to whatever language has been proposed. So it might not be necessarily the most up-to-date language in terms of incorporating your comments, but you can at least have that link available through the board's website under the public notices tab. You should be able to access a link at least to sort of the most recently publicly available rules, if that makes sense.
Yeah. Okay.
Yeah. And again, it'll just be through the website for the board. You go there, and you should be able to find that link.
Thank you.
Absolutely.
And Nate, I do want to make sure that I wasn't wrong in saying that you guys don't resend all these comments out to everybody else again, right? Only if there's another stakeholder meeting.
Yeah, exactly. I mean, in terms of like getting an e-blast and having it, sent directly to you, that only happens when there is a scheduled stakeholder meeting. But in terms of having the rule just available online, again, sort of just passively out there on the board's website. That will be still available through the whole process. But again, to UConn's point, it won't be sort of directed at you through email, through e-blast, until the next sort of step in the process, for sure. So yeah, you didn't misspeak there. I just wanted to make sure that there wasn't any confusion. And here at the end, if we're winding down here, it seems like a little bit, but we will close this out, and I'll provide you all with the contact information for the rulemaking inbox, for submitting those written comments as we move forward here. All right. I don't see any hands raised at the moment. Doesn't look like we've gotten any additional comments to read out loud at this point, but why don't we go ahead and give it another minute or so. If anybody is furiously typing out a comment or gathering your thoughts here before we close this out. Certainly don't want to cut anybody off, but don't need to belabor the point either if we've made it through everybody who wants to have their voice heard today. So why don't we go ahead and give it till 2:05 on my clock, and then we can wrap this up. And as we're waiting to wrap this up, I did just want to say one more time that how much we appreciate each and every one of you coming out here today and being part of this process. We wouldn't really be able to do what we do here without your expert input and these rules, making sure that what we do is the most keeps the public safe and is fair to everybody in the industry, and having the best rules possible. So really just wanted to state our appreciation for you all coming out here and being involved in this process. And I can definitely say that this has been one of the more robust stakeholder discussions that we've had. Very, very heartening to see so many folks so deeply engaged in this. All right, so with that, let's go ahead and close this out. Seems like we don't have any additional comments. So, all right, thank you so much for participating in today's meeting. As part of this collaborative process, all comments and program recommendations will be provided to the board for review before the next board meeting on November 13th, 2024. Or I guess it would have been in January sometime. Excuse me, that's a typo there. Any proposed revisions by the board will be made available to stakeholders for additional comments prior to the board's rulemaking hearing, which will be sometime early next year. All rulemaking information can be found on the board's website under the Public Notices tab, and written comments may be sent to Dora_DPO_rulemaking@state.co.us. Again, if you have written comments that you'd like to submit to the board, it's Dora, DORA_DPO_rulemaking@state.co.us. And with that concludes the stakeholder meeting. Thank you again for your participation.